All right, I'm going to make this video to try and express some thoughts and ideas in the hopes that I can bring a little bit of clarity, both for myself and perhaps others who might have an expressed interest in some of the works that I do. Um, Many who come to wish for my help usually will have some aspect of pain, limitation, or concern about something, and they're looking for answers. And they're looking for, of course, results of remedy for pain and discomfort, or to be able to move better. And all of that pretty much ascribes with what I do both as a chiropractic physician, postural restorative practitioner, as well as a massage therapist. All of these things coming together to make that difference at the table for an individual. However, what I have come to perhaps realize is that there are some very distinct separations between the works that I do and the paradigm by which people have come to understand some of the works that I provide. Um, on one level, there is the aspects of working with people on a structural aspect. People have something that physically is limiting and is creating a disrupt to the function of how the body can present itself. And with that limitation, I lean to say that, I'm working mostly, from the mind, from the thinking process, and the ability to bring information that both I have learned and have put to a model of practice to help an individual benefit in the works of what I can provide. In this case, they're looking to acquire from the knowledge that I have, the experience that I have, the results that I've produced, and it's a very intellectual relationship involving, hands-on structural-based work. That also involves a variety of tools that I might use, depending on, what the limitations are. From a second perspective, there is a space that I work within, generally, in regard to providing massage work, and that is more from the heart space. It brings a tremendous amount of empathy, compassion, a sense of what a person might be experiencing relative to their pain or their hurts. Um, it's not uncommon that a person may come in, they have back pain, they have neck pain, a particular joint pain, and in the process of working with them, I can, shall we say, tune in to other levels of pain, discomfort, hurts, things that are not always in the present per se as to what that experience might have been to bring that about, but that the client is experiencing that very much in the present. It's not uncommon that in both of these works, both the structural restorative work as a physician and the more comforting, relaxing, empathic-based work as a massage therapist, that recipients have acknowledged that there's something more that I bring to the table. So I'm going to effort to offer a third paradigm, an understanding that kind of answers what might be happening and is perhaps what is my essential capacity, gift, skill, what it is I'm able to truly bring to the table. And it comes from the very unique individuals that I will do work with from a third aspect. That's more a soul space. It's being open, connective, not just to that one individual, but in facets of perhaps, our world, our universe as a whole. And in that place of somewhat peace and application of listening and providing an unwinding of the various aspects of interference and tensions and pains, this hard to describe tapestry of layers and layers of things that are weighing down on this individual, it is work that occurs with, to some degree, an experience of effort on my behalf. I might break a keen sweat while working in massage, or find myself labored to breathe because I'm explaining so much information in my doctoring work. But in this third capacity, it seems as if an hour's time or more goes by and it's a moment effortless. And yet the results of both the patient and or client demonstrating an unwinding of multifacets of the structure of the body, a sense of relaxation, of processing, improved breathing. It continues to fascinate me how this aspect of work is so diametrically involving and at the same time clearing. And at the same time, it is probably the highest level of oddity and strangeness to a client. They don't necessarily know to ask for it. It's something that evolves while working with someone over a period of time, that they might ask to journey a little bit further and to see what might be accomplished. And perhaps, the paradigm is in the world of energetic medicine. It's fair to say that that's probably where it exists in the studies and the learnings of the meridians and the chakra system and mindfulness and things that can be accomplished in a state of calm meditation and a letting go, a true letting go of oneself, one's pains, one's worries, one's expectations. So I share in this video perhaps a delineation of these three facets of work that I dabble in now going into my 26th year of learning and applying, that I still feel like it is a genuine beginning, but I feel confident in those works and that I can make a difference, and that if I can keep myself clear of what I might expect of myself and what I might expect of a patient and a client, that it will continue to flourish and grow and become something that really can be impactful beyond just the individual that is receiving those works. So with that, to myself and to whatever audience may have an opportunity to hear these words shared, I thank you for your ear and your heart space, and the hopes that if there is something to be learned and shared from this message, that it find itself forward. All right, good day.